Hello. In this video, we will be discussing the major arteries and veins that make up our peripheral vascular system. We'll also talk about diagnostic testing and different types of catheterization. Finally, we will look at common vascular instrumentation and supplies, as well as common medications used in vascular surgery. Now let's name some of the major arteries and veins in the body, beginning with the great vessels. The great vessels are the large vessels that have a direct connection with the heart. They are the aorta, which is the largest artery in the body from which all other arteries branch, the superior and inferior vena cava, which are the largest veins, the right and left pulmonary arteries, and the two right and two left pulmonary veins. The right and left carotid arteries supply the brain with a fresh supply of blood. Branches of this artery join to form the circle of Willis, surrounding the brainstem. Deoxygenated blood is returned to the superior vena cava via the right and left jugular veins. Major arteries of the upper extremities include the subclavian, brachial, and radial arteries. In general, veins are named for the arteries in which they run parallel to, such as the subclavian vein. The renal arteries and veins to and from the kidneys. The mesenteric artery and veins to and from a large portion of the gastrointestinal tract. The common iliac arteries are the bifurcations branching from the distal abdominal aorta and become the femoral artery supplying blood to the lower extremities. Blood is forced upwards from the lower extremities through the longest vein in the body, the great saphenous vein, and other collateral vessels. Despite declining blood pressure and gravity, this is accomplished with the assistance of skeletal muscles in the leg and valves which ensure one-way flow. The aorta is the largest artery in the body and is divided into three regions. The first region ascends from the left ventricle of the heart. The first arteries to branch from the ascending aorta are the right and left coronary arteries, supplying the freshest of all blood to the myocardium of the heart. The second region is the aortic arch, which has three major branches. The brachiocephalic artery, which transports blood to the right side of the head and neck, and then divides into the right subclavian artery leading to the arms and the right common carotid artery. The next branch from the aortic arch is the left common carotid artery, and the third branch is the left subclavian artery transporting blood to the left arm. The third region is the descending aorta and is further described as the thoracic aorta, which is above the diaphragm, and the abdominal aorta, which is below the diaphragm. From the thoracic aorta, arterial branches supply blood to the lungs, ribs, esophagus, and diaphragm. Arterial branches from the abdominal aorta supply blood to the abdominal walls and organs, the pelvis, and at the bifurcation, the common iliac artery supplying blood to the lower extremities. Diagnostic tests may be done prior to surgery or may be performed intraoperatively. The sound you hear is from a Doppler scan. As blood flows through a vessel, the Doppler probe converts the flow to an audible sound. A vascular murmur or bruit, spelled B-R-U-I-T, is the abnormal sound generated by turbulent flow of blood in an artery. This can be due to either a partial obstruction or a localized high rate of blood flow through an unobstructed artery. Ultrasonography uses high-frequency sound waves to produce an image. A duplex ultrasound combines Doppler and ultrasound to listen and see blood flow within the vessels. Probes used for Doppler and ultrasonography require gel, and probes can be sterilely draped and used intraoperatively. Plethysmography measures changes in pressure in different parts of the body. Blood pressure cuffs are placed at different locations and then inflated. Angiography is performed by injecting contrast medium into the arterial or venous system under fluoroscopy. This test highlights areas of stenosis or an occluded vessel, and it provides information on the location of vessels to plan for surgical procedures. You should recognize this image by now as the circle of Willis that surrounds the brainstem. So how do they gain access to the vessels for endovascular diagnostic testing and procedures? The Seldinger technique is often used for the percutaneous insertion of catheters into the vessel. The technique involves inserting a spinal needle with an inner cannula into the vessel until blood spurts from the cannula. Then a flexible guide wire is carefully threaded through the cannula into the vessel. The needle is then removed, taking care to leave the guide wire in place. A catheter is then placed over the guide wire and into the vessel. Finally, the guide wire is removed, leaving the catheter in place. The surgical technologist should flush all needles and catheters and wet the guide wire using heparinized saline prior to insertion. Ultrasound may be used to confirm catheterization of the vessel. Another technique is known as a cut-down, in which an incision is made over the vessel and the tissue is dissected down to expose the vessel for direct visualization. The catheter is then positioned in the same manner as the percutaneous Seldinger technique. Hemodialysis is the treatment for advanced kidney failure. Blood is routed to a dialyzer via a catheter which filters the blood to remove waste. It is then returned to the body via a separate catheter. Arteriovenous fistula is one option for dialysis and involves making a side-to-side anastomosis between an artery and a vein. Over time, the higher pressure within the artery will enlarge and strengthen the vein for repeated catheterizations. The fistula must mature over a period of time before it can be used for dialysis. AV fistula is considered the gold standard option for long-term dialysis and is preferred over other methods. In some cases, a synthetic graft may be sutured end to end between an artery and a vein. An advantage of using a graft is that it doesn't need as much time to mature before it can be used for dialysis. However, grafts have an increased potential for clotting and infection. The surgeon will help the patient decide which option is best for their particular needs. Another option, used primarily for immediate short-term hemodialysis, is the insertion of a perm cath. The catheter is designed to tunnel under the skin to minimize discomfort and reduce complications. Nevertheless, the risk of infection is high when a perm cath is used. Most commonly, the catheter is placed inside the large internal jugular vein of the neck, but may also be placed in the femoral vein. A double port, double lumen catheter is required for dialysis. A particular catheter called a Groschung may be used. The catheter is opened only when positive pressure is present for fluid administration. Blood may also be withdrawn when negative pressure is applied. A portacath is similar to the perm cath. The term portacath is a combination of the words portal and catheter. The port or portal is a small reservoir about as big as a thimble, with a silicone septum that can be pierced with a needle. The silicone is self-sealing and can be punctured hundreds of times before the port must be replaced so it can remain in place for many years. The cath or catheter portion is the plastic IV tubing which attaches to the port. The catheters are placed by an interventional radiologist or surgeon under local anesthetic, using ultrasound to guide the catheter into the vein. The entire portacath is inside the body so that bathing and swimming are not affected. The port feels like a bump under the skin, about the size of a quarter. Portacath is commonly used for the long-term intravenous administration of chemotherapy. A PICC line is the term for a peripherally inserted central catheter and is for short-term use. Catheters may also be placed to provide antibiotic therapy and the delivery of intravenous fluids and pain meds. Specialized instrumentation includes various sizes and shaped vascular clamps. These clamps have atraumatic serrations to minimize any damage to the vessels. Common types are DeBakey and Cooley clamps. These may fully or partially occlude vessels. The Castro Viejo needle holder, in either a locking or non-locking version, is designed to hold small needles. Atraumatic bulldog clamps, also in various shapes and sizes, may be used for temporary occlusion of a vessel. A small incision into a vessel is commonly made with an 11 blade and further extended using Pott's scissors. Hemoclip pliers, used to place permanent clips to occlude the vessels, are often used. The clips come in multiple sizes and come loaded in a colored cartridge. Hemoclip cartridges are countable items. The pliers may be reusable or disposable. DeBakey forceps are atraumatic and designed to hold soft tissue while minimizing trauma. Small, blunt dilators and probes may be used to open and enlarge the lumen of vessels. Very small vessels require the use of microvascular instruments and loops or a microscope for magnification. Several types of medications are frequently used in vascular surgery. Heparin is an anticoagulant that may be given systemically through an IV prior to the placement of an including vascular clamp. Heparin is reversed with protamine sulfate. Heparinized saline is used as an irrigation to flush the lumen of vessel grafts, shunts, and to clear the field of blood. Papaverin is a vasodilator and may be injected or may be used to soak an autologous vessel graft prior to implantation. Thrombin is a vasoconstrictor used to soak gel foam and help with hemostasis. As always, the accurate and immediate labeling of any fluid or medication used on the field is required. Some supplies common to vascular surgery are umbilical tape and vessel loops, used to isolate and retract vessels. Suture boots are placed on the tips of mosquito clamps used for tagging to prevent damage to fine sutures. Suture used in vascular surgery is usually synthetic and non-absorbable, such as Prolene. It may be either single or double-armed and range in sizes from 0 to 10-0. The surgical technologist must be extremely vigilant in keeping track of all suture needles. It is recommended to use a magnetic needle box to secure the needle that are sometimes smaller than an eyelash. Suture boots, umbilical tape, vessel loops, hemoclip cartridges, and any other small supplies should be counted by both the surgical technologist and the circulator. Small felt squares made of absorbent cotton are called pledgets. Pledgets are used as buttresses under suture when there is a risk of the suture tearing through tissue. They also place pressure on the suture sites to help control bleeding. Often, the surgical technologist will load several sutures with pledgets during setup to help the surgeon quickly respond to a bleeding vessel, should it occur. There are some suture that come preloaded with pledgets. Anytime a large amount of bleeding is possible, a cell saver suction device may be used. The cell saver infuses blood with heparinized saline as it enters the suction tubing. The cell saver machine filters the blood so that it can be given back to the patient, reducing the amount of donor blood given to patient and possibly avoiding the need for a blood transfusion. Finally, biologic and synthetic grafts are commonly used to bypass or reconstruct a vessel. Certain types of graft, such as those made of Dacron, require pre-clotting. Pre-clotting involves soaking the graft in venous blood drawn from the patient prior to placing in the body. A small basin or pitcher may be used for pre-clotting. We have named many of the major arteries and veins that make up our peripheral vascular system. We talked about diagnostic testing, such as duplex ultrasonography. Also techniques to gain access to vessels, such as the Seldinger and the cut-down technique for catheterization. Types of catheters discussed are the Groschung, Permcath, Portacath, and PICC line. We also learned about common vascular instrumentation, atraumatic in their design, and supplies such as pledgets, suture boots, and vessel loops. We talked about common medications used in vascular surgery like heparin, protamine sulfate, papaverin, and thrombin. The surgical technologist should expect any surgical procedure to include some aspects of vascular surgery. The utmost skill and professionalism is required to specialize in vascular surgery. The outcome of the procedure depends on the ability of the OR personnel to function quickly as a team. Thanks for watching.